Interventional Cardiology and Radiology is a non-surgical option which uses a small flexible tube called a catheter to repair or damaged the blood vessels which is narrowed and other affected parts of the heart structures. So it's mainly it is used to diagnose special diagnosis and treat heart or blood vessels condition by using a small tubes that is called a coronary catheters that will be inserted via brachial and radial artery. So what is interventional cardiology? So the interventional cardiology uses catheters, that is coronary catheters, to diagnose or treat heart disease. So treatment means that is a percutaneous transluminal coronary angioplasty. What conditions are treated by interventional cardiology? So mainly we will treat that ischemic heart disease. Ischemic heart disease means if there is any diminished blood supply to myocardium, and any valve diseases and congenital heart disease like atrial septal defect or ventral septal defect. So interventional cardiology test here includes mainly computed tomography, intracardiac echocardiogram, and MRI, that is magnetic resonance imaging, and chest X-ray. Computed tomography of coronary arteries is a powerful X-ray machine to produce images of the heart and its blood vessels. So mainly it helps to diagnose a variety of heart conditions. So why we are doing? So mainly we are doing in order to check the narrowed or blocked arteries so that we can measure how much it's narrowed or blocked and we can do the further management. So what are the risk factors? So mainly what will happen here, the patient will be exposed towards contrast agents and the amount varies and the contrast agent mainly that ultra waste we will be using, and so that will be mainly it will be causing as a contraindication for the patient and it will be causing some hazard to the patient, mainly it will be for children and pregnant women. So how we have to prepare for coronary angiography? Mainly we have to keep the food and medications should be withheld at least 4 hours prior to the test, and we have to remove the clothing and jewelry for jewelry before the procedure. So what we will do during the procedure? So at the time when we are pushing that contrast agent through the IV arm, the patient will be feeling a numbing sensations when the dye is injected through the patient's body. So at the time after injecting the contrast agents, the CT images of the heart in various views will be taken. So the patient will be on the cath table and the electrodes will be connected to the cardiac monitor. So here when at the time of injecting the cardiac agent, so actually the cardiologist will be asking the patient to hold the breath for some time, and that CT operating person will be rotating the machine in a different position in order to view the coronary arteries to diagnose the narrowing of the coronary arteries. So actually this scanning will be taking a few to 5 seconds. So once the images of the coronary angiogram will be readily, it will be available once it's completed, so that the doctors will be discussing how much amount of area is narrowed or blocked. Based on that, they will be planning for further management. So what are the activities? Usually we will insist the patient. We will ask them to exercise regularly, eat healthy foods, stop smoking, and manage health conditions and to reduce the stress. So what is intracardiac echocardiogram? So intracardiac echocardiogram is a test users hear sound waves, that is ultrasound transducer. We will be keeping the patient's body in order to assess the surface and walls of the heart. So when it is used, so mainly this procedure will be used to check out the signs of infection in the heart, problems such as abnormal heart walls or any holes in the heart health and blood flow to the lungs, whether it's in a proper manner or diminished. These all the things will be monitored. So how do we prepare the patient for the test? Avoid taking any medications, that is antihypertensive or any antiarrhythmic drugs, and we will keep the patient in NPO 5 to 6 hours, and we should ask the patient to stop smoking at least 6 to 8 weeks, and all the required investigations should be done before the procedure and the report should be collected. So what happens during the test? So here the doctor will be giving a local anesthesia 2 ml to numb the area. After that, the catheter will be inserted through the skin, either groin or brachial or radial, and the tip of the catheter will be placed inside the heart. When the probe is placed in the right place, the ultrasound waves are used to make pictures of the inside of the heart. So at the end of the test, the doctor will be removing the catheter and they will be giving the pressure for some time at the puncture site to control bleeding. The test usually it will be taking an hour. So what happens after the test? So after the test, the patient may stay in a recovery area at least a few hours or overnight, and we will be keeping a sandbag to give compression. Sometimes the patient may be having some bruisedness in the puncture site for a few days. That is common, and the patient should avoid heavy activities for a few days. So what are the risk factors? The patient may have some problem with anesthesia. Sometimes it's a rare condition. There may be a chance of getting infection, bleeding or blood clot. And sometimes the patient may get accidental injury at during the procedure, and sometimes there may be a chance of getting irregular heart rhythm. And while not common, very rare, there is a chance of getting heart attack or stroke. Heart MRI is a scan. Here the radio waves and magnets create images without anything we can see or feel going into the body. So here they will be assessing the chambers, valves and muscles. What can a heart MRI diagnose? To rule out chest pain, shortness of breath or fainting. And here we can assess the thickening of the heart failure, heart muscle damage, any inflammation, infiltration and infection. And even we can find out the leaky walls, narrowed walls and prosthetic walls, and any iron deposition in the heart, whether there is any infection or inflammation of the heart walls, or even the congenital heart disease, any malignant changes in the heart also we can diagnose. So how does the heart MRI work? So here also it's a imaging a cardiac MRI. It uses a magnet and radio waves to create high quality images of the heart. And here the health provider can check the database to see the devices. And mainly we will ask whether the patient has any history of allergy before the procedure. What to expect on the day of MRI? So here the patient can take normal medicines and eat regular meals, and we should advise the patient to remove all jewelry and remove any eyeglasses, any dentures or any metal aids, anything. And the patient will be wearing the comfortable clothes. That is, we will advise the patient to change in hospital gown. What to So during the MRI, so the patient will be lie on the bed, and the machine will be that electronic video will be placed, and through the transducer they will be assessing the heart. That is through a microphone and headphones or intercom with the person. The person also can hear the what we expect after MRI. So here, after MRI, so usually at the time of MRI, the patient may be having IV lines, so that is the precaution. If it's needed, we will be inserting. So after completion of the procedure, we can remove the IV line, and the patient can go for its normal activities. So chest X-ray, as we know, here we will be assessing the images of the heart, lungs, and bones. Another name usually called as chest radiograph. So what are X-rays? X-rays are mainly it's a beam of radiation create pictures inside of the patient body. So when we will take chest X-ray means that the patient has any ongoing chest pain or any chronic cough, difficulty breathing, any fever, congestive heart failure, emphysema or COPD or lung cancer, pneumonia or any rib cage injuries. So what we will propose for chest X-ray. So here also we will make the patient to change in the hospital gown, and we will ask the patient to remove all the jewelry. So what we will expect after the chest X-ray. So when you are getting the clear images, we will send the patient back, and the images are blurry, and if it's not clear, we will retake the X-ray. So what is interventional radiology? So here it's nothing but medical imaging to guide a minimally invasive surgical procedure that diagnose, treat and cure many kind of conditions. So embolization is a minimally invasive procedure. It either helps to block or closes a specific blood vessels. So purpose for eliminating, closing, stopping or prevention. Eliminating like atypical connections between blood vessels, closing if there is any tumors and other abnormal growths, stopping or prevention is that if there is any excessive bleeding. How does an embolization procedure work? So here the tiny particles or objects that is called the embolic agents halt blood flow. Here this embolic agents will be delivered through a tin catheters, and the catheters will be puncturing through the skin, and the instruments will be placed at the tip of the catheter, so it will be easy to carry out the. So chemoembolization is a type of palliative treatment for mainly it will be used for liver cancer. So here in chemoembolization, three chemotherapy drugs are injected into the patient's artery, so that is mainly supplies blood to the tumor in the liver. So here what will happen when we are injecting the agents? This will be blocking the area with a mixture of oil and tiny particles. So after that, what will happen? The tumor become deprived of oxygen and nutrients once the blood supply is blocked. So the tumor will be getting shrunken, and mainly we will be injecting these drugs, the chemotherapy drugs at the tumor site in the dosage of 20 to 200 times greater. So here, when we are injecting the drug, the patient will be having a warm sensation that will be a calm, and we have to explain to the patient, and since the artery is blocked, no blood washes through the tumor. So here the drugs stay in the tumor for a month or a longer time. So what will happen? There will be decrease in the side effect because the drugs are trapped in the liver instead of circulating throughout the body. So when comparing with IV chemotherapy, this will be better because the patient will be having a minimal side effect. Ablation, catheter ablation is a minimally invasive treatment for heartbeats. If the patient having any premature heartbeats or any premature arrhythmia. So to ablate that, we will be inserting, that is otherwise called as electrophysiology therapy. Here we will be inserting a catheter and we will be ablating the immature beats, that is called arrhythmia. Balloon and stent, that is mainly placed at the time of percutaneous coronary angioplasty. And the stent will be placed on the balloon, tip of the balloon, and the size of the stent will be varied. That will be measured based on the amount of blockage. The doctor will be choosing the size of the stent. So here there are two types of stent: bar stent and balloon drug-eluting stent. But the prognosis will be better when we are comparing with the bar stent. The drug-eluting stent will be it will be better. So here the doctors will use the stent at the tip of the balloon. The stent will be placed and it will be inserted into the coronary arteries. Electrophysiology or test that helps to understand the cause of heart arrhythmias, and further we can go for ablation. So here certain medication will be working at the time of ablation to destroy the abnormal electrical signal. So that is called the catheter ablation. So we will find out exactly where the premature beats are arising. So through by using certain catheter, we will be ablating the premature beats. So mainly the complications of this procedure, the cardiac ablation, is the patient may have a syncope attack, and some rare case there may be a chance of cardiac death due to cardiac arrest. So atherectomy is a minimally invasive procedure. So here mainly the cardiology, the healthcare provider will be removing the plaque which is filled up and it is further narrowing or blocking the arteries, so that it will helps to restore normal blood flow and relieve symptoms. Thank you.